In this episode of the Courageous Public Health Podcast, LaTonya Bynum shares what it looks like when prevention stops being theoretical and becomes a decision about your own body, your own life, and your own future. After learning she carried a genetic risk for cancer, LaTonya was offered preventive surgery. Instead, she made a different choice, one that required her to confront stress, identity, and the conditions shaping her health. This is a conversation about courage, prevention, and reinvention, and what happens when we apply public health not just to communities, but to ourselves. You're listening to the Courageous Public Health Podcast, episode 51.
To all the courageous women leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I am an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have real, unfiltered conversations with women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then listen to this new episode.
Hello, and welcome to the Courageous Public Health Podcast. I'm Dr. Christy McClamrock. Over time, I have come to see something clearly. Courage is already everywhere in public health. It's just rarely named, supported, or treated as a leadership skill. Women are navigating complex systems, making high-stakes decisions, and holding a tremendous amount, often without the structures they need to do that work sustainably. Through Courageous Public Health, I partner with organizations to help shift that, supporting leaders to act with clarity and integrity, even when the systems around them are under pressure. And this podcast is part of that work. Today's conversation is a powerful example of what that looks like in practice. So let's get started. LaTonya Bynum is a certified grant writer and master certified health education specialist with over 2 decades of experience in public health writing, research, and training. As founder and senior consultant of U.R.A. Resource Center, she has secured and managed over 20 federal, state, and nonprofit grants and contracts across more than 10 states, specializing in strategic planning, program evaluation, and workforce development. LaTonya has authored more than 100 educational toolkits, peer-reviewed publications, and technical reports, including community health needs assessments and data-driven grant proposals. Her expertise spans SAS programming, GIS mapping, and digital content development, with a strong focus on translating complex data into actionable insights. She's a published author, app developer, and national speaker recognized for advancing equity and innovation in public health. Let's hear what courage looks like in practice.
Hi, everybody. Okay, so I know I say this every time, but I'm really excited about my guest today. Yes, I want to introduce you to LaTonya Bynum. Hi, LaTonya.
Hi, Dr. Christy. I'm honored to be here. As I've said before, it's a real honor.
It is also an honor for me. We've been connected on LinkedIn for a while, and this is it. This is the time for us to really dig into that connection. So I want to let you, I introduced your name, but I want to let you introduce yourself to our listeners.
Yes. So first of all, I want to start out. This is 1 year later that I'm circling back around. I saw your podcast popping out on my LinkedIn feed. And at the time, it was last year this time, I was like, I want to reach out to her. I think I'm ready. I want to tell my courageous story. And I have to tell the listeners, when I read the questions you were going to be asked, I was like, oh, I am not ready at all. So I just have to start off by saying, I feel like I'm ready for your podcast. It is such an honor. I've listened to so many episodes, and I just feel like I'm honored and I'm so ready. My name is LaTonya Bynum. Greetings from Conway, Arkansas. I have been in public health, the public health space, for over 20 years. I actually started off at the state health department here in Arkansas as a secretary. I don't know how many people are listening that started off as secretaries, but once I graduated with my bachelor's degree in health education, I said, oh, I need a job. And the health department was my foot in the door, and I was so grateful. I started off as a secretary making, I think it was $8 an hour, just starting off. I was so happy. Getting into the health department, working in health statistics, I learned 3 skills were evident, and I just needed to focus on them more. My writing, my research, and also my ability to talk. I love answering the phones. I love greeting people. I love explaining data. And I know that you are an epidemiologist and just working with super smart people who were around me all the time, talking about data and analyzing data, conducting burden assessments, community health needs assessments. I was like, I want some of that. And so I bring you greetings from Arkansas, starting off as a secretary. And from there, I learned how to run SAS code on the job. I learned how to coordinate a national and statewide survey called the Behavioral Risk Factor Surveillance System Survey, which is like the go-to survey in terms of adult health risk behaviors and monitoring trends from state to state. And so they said, LaTonya, if you can speak Spanish, answer these phones, you can learn SAS, you can help us with this data. And I was like, okay, like, how is this all going to fit? And plus, my background was in health education. At the time, I was the only health educator on staff. Everybody else was biostatisticians and epidemiologists and stuff that I really couldn't even say at the time. Epidemiologists. It was like a huge, long, big word. And I was like, oh my God, I don't want to mess this up. And so just starting off working with them, I noticed that when people would call, I started being a translator on what they were actually asking the epidemiologists and the biostatisticians. And people always thought that asking statistical questions was really hard and they didn't want to feel dumb. And I would be the one to intercede and translate. And so that's how I felt my niche in public health, starting from a secretary into now being a consultant. I actually yesterday was my 9th year anniversary of being the founder and CEO of U.R.A. Resource Center, LLC, which came as a startup after leaving the health department. Everybody at the health department and in the community, LaTonya, you are such a resource. And so that's how I started off from humble beginnings as a secretary. And I've written books, developed apps, 20 programs, like just all of these things. But once again, I still didn't feel courageous enough to be on your podcast. And here I am today.
Here you are. This is your act of courage. This is one of your many acts of courage today.
Today. I love that. Today. Yes.
Is to be on here, right? Because we're doing courageous things all the time. And let's call them out. Let's shout them out.
We got to say that.
Yes, it is MLK Day today.
Yes, Dr. Martin Luther King. He would be so proud of us. Yes.
Yes, absolutely. Absolutely. Well, okay. That was a great introduction. And you have already jumped into question 1, which is awesome, and shared the first example of courage. But I would love to hear some more examples of courage in your personal life and in your professional life.
Yes, I do feel like when I was at the health department and starting off as a secretary and just kind of getting my your confidence. Because at first I was just like, I don't belong here. I just felt like such an imposter. Yes, I had the degree. Yes, I had customer service experience from working as a cashier all of my life. But I still didn't feel like I belonged there. But once I started learning SAS and analyzing the data, and my request for information emails were going out and people were asking questions. They started asking me, LaTonya, like, can you get some more credentials? And I thought to myself, like, this job don't even require the CHES that I'm supposed to have. So one of the credentials that health educators can have is either certified health education specialist or a master certified health education specialist. So in 2007, I took the CHES exam, the certified health education specialist exam, and I failed it by 3 points. 3 points. And I was thinking, the National Commission for Health Education Credentialing, they should just gave me the, you know what I'm saying? They should just pass me along like 3 points. That's like margin of error. Like, I was just thinking they should have just let me get through it, but they don't want people out here practicing that can't pass the exam. So, so unfortunately, because I felt like everybody at the health department had all these alphabet soups behind their name, like all these credentials, and I'm just sitting here with my BS, my Bachelor of Science degree, and I was like, oh, I don't need it. I failed. I was just feeling low, like, God. And so it took me another 7 years, still working at the health department, going through promotions, writing papers. And I started to think like, okay, I think I got enough work experience. Because at first I had like book experience, but I felt like I was grounded by then. Like I had been down through there. I've been asked questions by super smart people about statistics and p-values and stuff. So I was like, okay, I'm ready. Like, let's do it. Took the CHES exam again, Dr. Christy, and I passed in 2011. And when I passed, I started, putting my credentials behind my name on LinkedIn and in my email. And then I started publishing papers, and people were like, okay, we can listen to her. I think she knows something. Okay.
Yes.
I felt like I started getting that respect, but people also started reaching out to me because I was sharing tips, and I was talking about how the first time I failed. Most people, they weren't talking about they failed. They just said, congratulate so-and-so for passing. Look, I went through this process and I studied these books, and like they were sharing resources, but they ain't talking about how many times they had failed.
Yeah.
And so I started sharing that, and 5 people got together. Well, actually this one lady, she reached out to me. She was like, LaTonya, do you have any resources? I'm trying to pass. I didn't fail it one time. I'm a nurse, and I'm trying to transition into public health. And so I shared some resources with her, and she was like, oh my God, this is so good. Like, I didn't know this even existed. So I just listed out like at the time it was the 7 areas of responsibility and the terms that you need to know in each area. So I gave her that information, and she was like, LaTonya, will you just train me? And I'm like, what you mean? Like, train you how? I gave you the resource. And she was like, no, can you just sit down and talk to me? I was like, okay. She was like, I'll give you $50. I was like, what? And by that time I had already converted myself into a consultant. Right. And I was like, okay. I said, do you mind if I get a couple more people together? And so I put this post out on LinkedIn.
Nice.
And I had 5 people. I trained them. All of them passed, Dr. Christy. And
That's amazing.
And I was just so proud of myself. I was like, oh my God, like, I wish somebody would have did this for me. Like, just pull me to the side and be like, this is what you need to focus on. Here's where you need to study. Like, the exam, is 3 hours. Like, just give me the lowdown. It's just too much information. Too much to, like, what do I focus? And so when all of them passed, I just started putting that out there that these people that are not passing, they need resources, and they just need somebody to just say, this is what you focus on. 50% of the exam is on areas of responsibility 1, 2, and 3 if you're going to pass the CHES, and if you're trying to pass the MCHES, areas 4, 6, and 7. Like, let's just focus there. And so once I started sharing those resources, people started coming to me and asking questions. I would share the resource. Then I developed a course. And so from that course, right now I have a 90% pass rate. Over 60 participants have gone through my course. I've turned them mostly into consultants. I'm like, okay, y'all been working at the health department too, but y'all can use these skills in other areas. We can help these EPIs, and we can help, we can help so many folks do these community health needs assessments that need to be done for all these hospitals. And so just getting the word out, I think that is the one professional courageous thing that I've done, which is start off feeling like I have the imposter syndrome because I only had a bachelor's degree, and then moving into, I'm going to take this CHES to add some credentials behind my name, and then moving into, I know it's some other people that's not passing this exam. I'm going to share these resources out here. And boom, here I go. I actually have a couple of folks going through the course right now. It's a 15-week course where I just walk them through some homework assignments and just kind of see, you know, if they're thinking like a health educator in order to pass the exam.
That is so, yeah, that's really, that is entrepreneurship right there. Like that is seeing a need and being creative, and then like, creating what people are looking for. Yeah.
A resource.
That's great. A resource. You're a resource. Yeah. I mean, that's the kind of thing I would like if I were taking the CHES, like I would yes, I want that kind of help. That kind of help is so incredibly useful. And I mean, I really love that you're talking about normalizing failing an exam. Like who among us has never failed a test in our lives, like never failed an exam, right? It happens. And it's not something to be ashamed of. It doesn't say anything about us as people, right? It's just like, I did not answer these questions correctly when I took the test this time. Like, it doesn't have to mean anything. I think we put so much.
That's probably what happened to me the first time. That's what I was thinking when I didn't pass it. That's why it took me another 7 years, because I'm like, oh, like, what, you know, I went through school, but I did take it right after I graduated. So I didn't have the work experience yet. And so I do believe that is the reason why people are like, no, you know, I failed it. Like, this is my identity. I'm a failure. No, this is an exam.
Oh my gosh.
You did not master the competencies. You can't do it right now.
And then you figure out when is the right time. You go back and you try again. You do it again. And then you have to try again. You try again. I mean, you know, like, yeah, absolutely.
It definitely.
But normalizing that for other people, I think, is huge. I think that's huge. Yeah.
Yes, I believe so. And to go on to get my master's certified health education specialist when I no longer need it as a founder and CEO, I just wanted to add that extra credibility and just know that I have mastered not only the CHES, but I have the MCHES now. Like, this is for me. And so now not only can I look at communities and help them with their community health needs assessments, but I also can evaluate programs to say, okay, based on what y'all said y'all was going to do, it didn't hit at all in this community. Like, it's not working. And so being able to translate for programs and help them to look at their data and talk to their people, listen to their people, I think, it's really helped my career. And just personally, just telling my story, I've been able to connect with so many folks that probably wouldn't have reached out because they think I'm smarter than them or something like that.
Yeah. That's great. That's great. I think you have another example to share. I know you have more examples to share.
So my professional example is with the CHES exam. And like I was telling you earlier, recently I have gone through a divorce. Now, in all of my previous podcasts, I talk over and over and over about being a wife, a mom of 3 children. So I have 3 children. I have a son and 2 daughters. My 2 daughters think they run everything around here, but my son, he runs everything. But going through a divorce, I thought I would be a wife forever. I was married 16 years and 8 months. So we're gonna put that as like my title of my 16 years and 8 months, and I do feel like that experience. And I do have to preface this by saying we get along so much better now. And we talk almost daily. Like I was talking to him early. Like we get along so much better. But I do feel like as a mother and a wife, that's another sense of I failed. Like, you know, we're talking about failure. Like it takes courage to just keep pushing. But I do feel like it wasn't him. It was me. It was me. And I do feel like just going through that process of grieving, because it's one thing to grieve a person when they have gone on, but what about grieving a person that's still here, alive and well?
Who you talk to every day.
Oh, you talk to every day. Like, but you, like, not in that capacity as lovers and, you know, seeing him every day. No. But I do feel like a lot of people that I had spoke to going through the CHES courses, once I got to really talking to them and we were talking on the phone, and like, you know, LaTonya, how do you do this? Like, what's going on? Like, why I can't pass? And I'm like, how are you doing? Like, what's going on with you? And I would tell you 9 times out of 10, most of the women, I mostly work with women in my consulting business. They're like, my love life is not where it should be. And I think for the longest time, I was happy in my marriage, but when I went through the process of my mom going through stage 2 cancer, she had triple negative breast cancer, which is a rare form of cancer. And they told me that I need to get a genetic test to see if I had the same hereditary gene. Dr. Christy, I spit in that little spigot and took the test, and they came back and they said, you got the BRCA1 gene, LaTonya. And I said, oh my God. And come to find out, a lot of my aunts on my mom's side, they had the same gene, you know, it's hereditary. And so this is where everything changed for me. The doctor said, you know, after my mom had a double mastectomy and I took care of her for a month, and I was telling my then husband, I told him, I said, I'm going to go down here and I'm going to take care of my mom. But if you call me worrying me about her, it's not going to be good. I'm going to get rid of you. And he didn't believe me, you know, but I felt in my heart that if I don't go down here while my mom's going through cancer, and if something happened to her, Dr. Christy, I would be forever wondering, like, could I have saved her life or what more I could have done? But at the same time, I was a wife, I was a mom, business owner. Like, I had all these other titles going on, but I said, I gotta let go all of that. I need to go down here and handle my mom. So I went and stayed almost 2 months and talked to her, came back, and it was an eye-opener seeing her almost lose her life and go through that process. But after the doctor said, you know, what we need to do is an elective surgery on you, LaTonya. We need to remove both of your breasts. And I said, I ain't got cancer. Like, he's like, I said, wait a minute. And he had scheduled the surgery and everything. My mom was like, I just went down through there with cancer. Tanya, you about to just get these breasts removed. I'm like, oh God, it was just all moving so fast. And I looked at my husband then, and I told him, I was like, you know, what are you going to think about me if I go through this? You know, they're going to remove my breast. And he said, you got to listen to the doctors. And I was thinking to myself, so I went and I scheduled an appointment with the man who was going to remove my breast. And I said, I really want to talk to you about this. I'm having some trouble making this decision. And and he said, well, what are you having trouble with? And I said, I don't want to deal with it. And I said, I did my own little research. And I know the women in my family and also my mom. One of the things that I noticed that's common in all of these situations is high stress. And I said, I'm in under a lot of stress. And he was like, okay. I said, instead of having an elective double mastectomy, I'm going to divorce my husband. He said, that's unconventional. He said, why would you do that? I said, because I know I need to lower my stress and I need to find myself. It's not him, it is me. And I've been living with that decision ever since that day. And so I canceled the surgery, Dr. Christy. I did all my paperwork online. My cousin was like, you can file your own divorce. And it wasn't a terrible marriage, but it's just like when your life flashes before your eyes and you see somebody that you love who's cared for you. My mama groomed me to be just like her. When I saw her go down through there and I've lost so many aunts and stuff, I thought to myself, this is what's next for me if I don't stop this. I don't know how else to stop this. You know, like a train is choo-choo, just going.
It's going down the tracks.
16 years and 8 months. And the only thing I really thought about was my kids. Like, what are they going to think? And then also the people. Like, Tanya, you book author and you talked about your husband. Like, girl, would you lie? But I'm like, no, y'all don't understand. I got to work on me. I got something going on that y'all I can't even explain it. Like, why I'm getting a divorce. But to this day, I do not regret my decision. I took a year off and really I had to put my bed on the floor because I was like, I don't need another man, because that's usually my first thought process, like find a replacement, like do something different. But just working on me and really getting into the groove of, my income changed.
Of course.
Just so many things that women typically worry about when thinking about divorce, it happened to me. And so I would say that personal inclination that if I don't do it, this is going to lead me to somewhere I don't want to be. And so I made that hard decision, and I'm so glad I did, because I feel like we get along better. Is better for the children, because what's the point of me being mad and sad, wondering like, can my stress be lower, or, can he treat me better? But really, it was me. Yeah. The whole time it was just me and my thought process on what he needed to be versus what I could be. I needed to change my ways. And so as a woman who's really thinking towards, I want to help others, so bad I wanted to save the world and help all these people, share all these resources. I feel like really focusing on the divorce, and now I feel like thinking about where it could be versus where it's at now, I'm so happy with my decision. And he is too. He was like, he thought I was playing. He thought I was scared. He didn't see it coming, but he saw the paperwork, but he's like, girl, you did it. And I'm like, yeah, I had to. But now it's like my mama, she's so proud of me. She was like, Tanya, because her and my dad, they got a divorce and then they got remarried. And she was like, baby, it's still hope for you. Y'all can get back together. Y'all can get back together. When she hear me, I'm on the phone with him. Yeah, y'all gonna get back together. No,
that's so funny.
Yeah. So, but yeah, people don't talk about failure in terms of losing your whole identity. Everybody's like, Miss Bynum. Now they like, Miss. I'm like, yeah, I used to be somebody's wife. Now who am I? You go through this whole metamorphosis of like, who am I? Like, am I not even valuable now because I'm not a wife? Or, like you just go through all those thought processes. But yes, I've worked on myself. I actually wrote an article recently about, just what I had to go through. People don't talk about what you have to go through when you make that decision. Your money change, they'll go through perimenopause. Don't know how many women in their 40s. And you go through so much. But it's like, man, this is life or death, man. I'm not finna die. And all the money my mama spent, I thought I was in public health, but the healthcare system, I didn't even know. The first thing, how to navigate, how to get a care coordinator, how to get my mama resources, starting her disability when she's retired. Like, oh my God, it's just so many things. But I'm blessed, extremely blessed to say I was somebody's wife, and now I'm just LaTonya.
I love that.
Mm-hmm.
I love that.
Yes.
Oh my gosh, there's just so much strength in what you're talking about. And I'm sure a lot of people will be able to relate to different pieces of your story, because, it is easy to believe the messages about who we're supposed to be.
Yes.
Right? We're supposed to be, whether it's, a wife or a mother, you're supposed to be a mother. You're supposed to, have reached this point in your career. You're supposed to have this much money. You're supposed to, it's like so many, there's the shoulds, right? It's so many shoulds. And it's like, what if we actually let go of the shoulds and we just got to be who we authentically are? I really think that the world would be a better place.
It would. But who gets the space and time, Yeah. And then the money I had saved up, it it's a lot that goes into the decision-making process. It's just how many people are actually in a mental space, in a financial space. It's multifaceted to really think about a decision like that. You know, especially when it's not abuse or neglect. Right. It's usually like, you know, women, he was this, he was that. No, it was really me. Like, I totally confessed. It was me. And how many women are going to say it's me? It's not him. Because I get on here and down talk him, but he's a great dad. Even now, then he was a great dad. He's an even better dad now. Yeah. He, you know, so I have nothing but good things to say about him, but I really needed to work on myself and figure out, why does this keep happening to women in my family? Like, what does my mom train me? Like, you know, I can't change heredity, but it's some things that I could change. Lifestyle factors.
I mean, this is public health, right? Like, you're thinking about prevention.
Yes.
And it's like, so here's one type of prevention that you're offered. And you're like, you know what? There are actually other ways that I can do the same thing and be thinking about prevention. And I'm going to choose something different. I'm going to choose something over here.
Yes.
And that's, I mean, that really does take a lot of courage.
Yes.
That takes a lot of courage.
A revolutionary decision. I like to think of it.
Absolutely. A revolutionary decision for you and for your life. And then it, you know, and then that impacts everyone around you, right? It impacts him. It sounds like for the better in a lot of ways, and your children.
Yeah, he looks good. I see him get ready for church and stuff. I feel like, okay. I see the little church women looking at him and stuff. I be like, okay. I drop the kids off and stuff. I just like, God, he looks good. And then I look so much better. Like, I can feel my being. I can feel the growth in me. I look forward to waking up instead of
right.
Like, all these kids and all this money I'm kicking out. Just so many things I was just worried about. I'm like, that don't matter. When you face life or death, or you see somebody's life flash in front of your eyes and you love them, you really start to think about, like, does this really matter? Like, you know, all these bills and stuff, this stuff still keep going. But I'm not finna go down through there. No.
Yeah. Okay. So I really want to ask you, so you're talking about all these examples of courage, and a lot of this is about being authentic, right? And claiming and expressing your power. And so I just want to ask you if you have any thoughts about doing that in spaces that don't always welcome it. And again, like, this may even be an example of that, right? Where there are other people in your life who don't understand why you got a divorce, or who don't understand why you didn't do the selective surgery. Like, and so I'm just wondering if you have any thoughts about that, and just sort of this piece around, like, expressing and embodying the courage that you have.
When I think about, so it took me a couple of years, almost months, to really say, I'm going to do it. I, you know, first internally I was thinking about it, and then I got to thinking about the surgery and seeing what my mom went through and stuff. And then I started to think about all these people that look up to me as a married woman, you know, being married 16 years and almost 17, but 16, I always say 16 years and 8 months. Like, I want my full credit, because my hat goes off to any married woman. Because that is a ministry, that is work. You're really working on yourself more than you're working on being this best mom, best wife, best family member. But it is a huge responsibility, and I don't take it lightly at all. But I know that my health was tied to my lifestyle and also how I thought I was supposed to be a wife. But when I thought about all my family members that I'd be disappointed, my mom and dad, like, you know, they call me Tunky Poo. Tunky Poo, what happened, baby? You didn't tell us all this was going on. And I'm like, they can't fix it as parents. You can't fix this. And so when I really got to thinking about all of the people and what they would think about me, I got to thinking, who was going to be here to pump my tubes and pull all that, you know, all the stuff I had to do for my mom as she got her breast removed? How many of them people are going to sit there and worry wipe me and take care of me. And I got to thinking, Dr. Christie, that don't even matter. They don't matter. All that worrying and stress that how am I going to explain it? And, what am I going to tell people? Like, I had to have like this perfect story. And I still, to this day, as you see, I'm still going over this decision in my mind, but I do know it works for me and it works for my children and it works for him. So at the end of the day, if it works for the people that are involved, me, him, and the children, I don't think anybody else should have anything to say about it. My kids are they're actually more resilient than I expected. Yes. And a happy mom is a happy family.
Yeah.
Yes.
Yeah.
And so I don't know. I don't worry about other people and what they're going to say because people are going to talk either way. They're like, dang, Tanya,
absolutely.
I wanted you to, I want to look up to you. Well, okay. I'm sorry.
Great. Look up to me still.
And if you don't find another leader that fits that model that you're looking for in leadership, if you want that, that wife, that mom, and all of that into one, there's many leaders who have that same profile, but I'm just not that one.
Yeah. And if people have thoughts and feelings about that, those are their thoughts and their feelings, and they can deal with them.
And they're welcome to whatever their thoughts and feelings are. That's their business, not mine.
Yes. Yes. That's amazing. That's amazing.
Yeah.
Okay. I don't
know if I answered the question, but I do feel like I don't care. Because at the end of the day, none of those people are really going to take care of me had I went ahead and elected to have my breast removed.
Yeah.
So, do they really matter?
No. It's like with love. You don't matter with love.
With love. I'm going to use that. With love. I love that, Dr. Christie. With love.
Love.
I love that.
Oh my gosh. Okay, so I wanna hear from you about your vision. This is one of my favorite parts of the interview is to get to hear about people's vision for the future. And I'm thinking, your vision for public health for sure, your vision maybe for your business, and then also your vision for your personal vision for your life.
Yes.
Yeah.
What a great question, because I've been thinking about that too. With all of the administrative changes in the political atmosphere for public health, are degrees valuable or not? Like what? All of these things have me thinking constantly. And even now I'm still trying to transform into who I want to be when I grow up. And here I am, 44 years old, like who am I? And so
I'm 52 and I'm doing it too. I'm totally doing the same thing.
Figure it out, because as a consultant, you have to ride the gravy train. Where's the funding in terms of contracts? And last year I was working on a NIH contract. I'll be honest, I was making $50 an hour. That was good money. Me and my kids are taking them to McDonald's whenever they want to. I just we just out here living the best life. And we got this notice in the email that this is a DEI type contract and the whole team is trash. It didn't say like that, but
sorry for that groan.
Money. So in a matter of a day, my main source of income went to zero. And I had to quickly think about, what am I going to do? So here's my vision.
Okay.
Because people have been calling me and asking me, LaTonya, what you doing? What you got going on? I'm like, girl, your guess is good as mine. But here's what I did. Because, remember I was telling you about the health department. I was trying to figure out, as a health educator, what can I do to help y'all out and also move out of this position as a secretary? I'm trying to make more money. I'm trying to go from $8 to something else higher.
Yeah, something else.
And so I quickly figured out you have to be a great listener. You have to be a great listener. So I would listen to the EPIs, listen to the statisticians, and go back and tell folks what they said, but in my own words. I'd be like, LaTonya, I understand you, but all that statistical jargon there with y'all, over my head, I didn't get it. So when I lost all the money, Dr. Christie, with the contract. I got to thinking about when we were doing that work, one of the things we were trying to figure out why cancer rates were so high in this one city, particularly one county in Arkansas. They have the highest cancer rates. When we got up there, did the community health needs assessment, we found out it wasn't that people were diagnosed just with cancer and not going to their appointments. It was because they didn't have a ride. It's a rural county. To get to the nearest doctor is like a 2-hour drive. Most folks, they ain't got a car, so they depend on a friend or family member to get them to the doctor. And I thought to myself, once you get a cancer diagnosis and then going, through the process with my mom and seeing her go down through there, I understood my dad is a driver. My mom doesn't drive at all. Had it not been for my dad driving her to her appointments from Hot Springs to Little Rock, you know what I'm saying? Because I couldn't have did that everywhere in my household. So long story short, this is my vision for public health, that we really look at the data. When I looked at the data in terms of the community health needs assessment we had conducted and looked at the insights from it, it said transportation was an issue. And I thought to myself, I'm like, okay, this contract is on, but the work is still out there. The work is still out there. And so since then, I have worked as a driver for a non-emergency medical support team, making almost half of what I used to make. But the experience is so rewarding. I am transporting Medicaid and Medicare clients to their appointments, meeting all these folks, and most of them be like, oh, this is so fun. I show up with my jacket on and my little shoes, my kids call them my church shoes. I open the door for them. We turn on the music. I get them to their appointment. I don't take a bunch of clients in a day. I'm there on time, mostly waiting on them outside. When they get in the car, I got them little crackers because they've been in there all day. Some of them have gone to dialysis and came out of there. They've been in there 3, 4, 5 hours. They just looking for a smiling face. They like, oh my God, this is so, and I'm like, and they like, we don't never get treated like this. They put us on the van and we be at all these appointments. We have to travel all day and then we get home at dark after going to our morning appointments. And so just learning about data, and being a part of that whole community health needs assessment and really looking at that insight. Who would have known that an NIH contract that I got let go of would be such a healing experience for me now as a divorced woman of 3 young children, but just listening to those people's stories and it makes me focus more on my own health. I'm down just 16 pounds because I'm seeing like, once you have an elective surgery or you're on dialysis, it's kind of like that's your new lifestyle. Yeah. You know what I'm saying? In terms of like, that's what you're going to have to do Monday, Wednesday, and Friday if you're on a 3-day treatment plan. So I would say my vision for public health workers who are really, like me, using credit cards to pay bills sometimes and, piecing together meals. It's taught me how to be a better cook at home because, like I was telling you before, at first I could take my kids to McDonald's whenever, hey, Mama, we want McDonald's. Now I'm like, baby, let's make McDonald's in the kitchen. Like, let's get these burgers and put them in the oven and let me look at the bread we're buying. Can we get a lower calorie, type of bread, maybe some wheat bread or something. So it's really helped me to really think through how personally public health is being applied in my household, how public health can heal me personally, because I need those riders just as much as they need me. They don't realize, but I tell them all the time, like, thank you so much for being so nice to me. Because it can be uncomfortable. Somebody getting in your car, you don't even know them. They don't know me and I don't know them, but just having that welcoming attitude and professionalism, but knowing what I know on the research side, actually doing the Qualtrics surveys and, going through the process of coding out all of that data and reporting the insights to the stakeholders in the community. Now I'm a driver. So who would have thought that one big, beautiful bill of everything they say we need to do, and then Project 2025 and all these things that we're just like, they don't get public health, they don't get prevention. How can I take that tool and really use it and reinvent myself in today's time and become an asset, a valuable resource to so many people who need me. So it's just a matter of time, Dr. Christy, that I figure out how to incorporate these billing codes, telehealth, and get these rides going. Because in the car, I'm talking about their health. They're asking me, what do you think about this? And, the doctor said this. So they're asking me questions. So it's just a matter of time, and I figure out how to do the billing part to, it's going to come. But I think we have to be innovative. We have to be authentic and tell the truth that these stories that we sometimes hear from the community are also our own personal stories. And we can relate as professionals and also on a personal level.
You're a problem solver. Like, you're an incredibly creative problem solver.
Thank you.
Really, I mean, yeah. And being open to, things not being the way that you thought they were going to go, right? Like, you didn't think you were going to be single again. You didn't think you were going to be, driving and not do. And you know what? We have to take life where, let me say that again. Life takes us where it's going to take us.
Oh, yes.
Right?
Yes.
And, when we are courageous, right, we can actually do some pretty spectacular things. We can do some pretty incredible things. Yeah.
And we have to be innovative problem solver.
Innovative. You're an innovative problem solver.
Yeah,
yes.
Especially in our own household. I think it starts in the household. Yeah. I never wanted to talk really about what's going on, but it started in the household. And then it's like it exponentially turned into, this is a professional thing that I'm going to help other people to see. Like, we can live better. We can do a little bit better if we take ownership that, yes, we might be problem solvers, but what about, are we solving our own problems?
Yeah. Mm-hmm. Okay. So tell me about your vision for yourself. Is there anything about your vision for your own future that you want to share?
Yeah, I think the vision for myself as a consultant, sometimes people think, consultant, so much. You have 20 years of experience. You've been in public health from secretary, book author, app, and, people know all of these things about me. But personally, I have been challenged nearly all my life by with being overweight. And I believe that a lot of I'm a comfort food eater. And I've noticed here lately that when I am doing something that I absolutely love, I don't eat as much. Mm-hmm. And when I'm around people like you, I feel energetic and I don't feel the need to be stress eating and all that. So personally, I want to live my healthiest life. And if that means you don't, understand it, because I really can't explain it right now, Dr. Chrissy, I'm just exploring the opportunities of what is this salad going to do for me? Like, how much more energy is it going to give me versus eating a honey bun like I used to do? And so I do feel like I'm still exploring personally what my vision could be. But I would say I've gone from being 360 to 349. And for me, that's a lot of weight. And before I got married, I was probably in my 330s. And so I'm looking forward to getting back to my pre-marriage weight because I feel like even though that's still a hobby in mine, it's when I had the most energy. And even as, I'm going through perimenopause, leading into my menopausal stage, hot flashes, cold flashes, and attitudes. And I'm going down through there, Dr. Chrissy. I do feel like my personal vision is to have optimal health, to feel my best, look my best, and to be a giver and also be around people who are just as giving. Because in the past, I've been around a bunch of just people who are very focused on take. Like, LaTonya, you got resources. I need this, need that. But I still want to serve people. I want to serve the community. But I understand my capacity. My capacity is for my children now. It's for my children. I feel like the more I pour into my children, the more I see quick results. And I love quick results. Like, I could teach my daughter and my son how to cook something. And next day I'm like, they're in the kitchen. They're so excited. And that probably would have never happened when I was overwhelmed and I ain't got time to be teaching these kids all day. Like, I don't, so I think just taking my time and resting. I feel so much better resting than I'm just ripping and running and doing all these things. So my personal vision for myself is to just really be healthy and whatever that means for me on a daily basis.
Yeah. Thank you so much for coming on. This has been a great conversation. I am sure our listeners have enjoyed it. I want to make sure that they know how to connect with you. What is the best way to do that?
Yes, the best way to connect with me is to find me on LinkedIn. I am LaTonya Bynum on LinkedIn, and I try to post almost every other day or at least weekly, just sharing resources or little tidbits and things that have helped me or things that I'm thinking about.
Yes.
I do want to say before we get off of here, Dr. Christy, it has been such an honor. I've listened to several of your podcasts. I didn't know what to expect or, what I could say or what I shouldn't say. So I have researched you. I am very honored, and not just honored, just so in awe of what you've done with your podcast and what a wonderful testament to the public health community. Some folks are thinking about starting their own podcast and they look at yours like, look at this woman, like, look at this one. She's handling all these interviews, asking these hard questions. And, I am such in awe. So congratulations. And you're in a thankless job too. Thank you so much. Thank you for what you're contributing to the public health community. Because without you, these stories would go unheard of and nobody would even know, like, most of these folks even exist. So thank you for what you're doing, and may God bless you and your family for the contributions you're making as a wife, as a mother, and then also a community leader, because people are looking up to you. And so as you think about your own personal identity in 2026, because I know all of us are challenged with, like, where's the revenue? What are we doing here? I want you to think in terms of what brings you the most joy, what brings you the most rest, and also what brings you that moment of, God, I didn't even know that was possible for me.
Yeah.
And to be on your podcast and have you interview me. I hadn't been on a podcast interview in probably over 3-4 years. And I was kind of scared to get on here, honestly. So I want to say thank you for being who you are and making this a pleasurable experience for me. And I'm going to tell so many other folks about you. And thank you. Thank you for being so nice to me. Like I tell my clients in the car, thank you for being so nice to me, because this could have went any kind of way.
Well, and we're just going to end on, I'm going to tell you that I've said this in some of my episodes, that I have all these necklaces with words on them. And so every morning I get to get up and decide like which word. And so I'm just going to tell you, I'm wearing joyful today. So you said, like, find the joy. Yes. I've got my joyful necklace on. It was perfect. It was meant to be for today.
Yes, it was.
Thank you.
Thank you for being so nice to me. And then another tip, every morning I wake up for just, clarity in my mind and a direction for the day. I have a Webster's dictionary in my room, and I open it up. Either I flip to the middle, front, or the back, and I look at a word. And then I just really just try to immerse myself in and try to use it at least 3 times a day. That has worked so much for, just a fun way to use the word, find new people to talk about what I've learned, or, it's a great conversation starter. And so I just want to say, it's really up to you how you want to live your life. Nobody can tell you whether it's right or wrong. You just have to do what's best for you. And it's okay to be different. Different is not wrong or right. It's just your choice.
Absolutely. Thank you so much.
Thank you.
Sometimes courage is telling the truth about your journey, including the moments when you didn't get it right the first time. Sometimes courage is making a decision that others don't understand, because it's what your life and your health require. Sometimes courage is redefining your path and using your skills in new ways to meet the needs right in front of you. LaTonya Bynum reminds us that prevention isn't just something we study. It's something we live through the conditions we choose to change in our own lives. If this conversation made you think about the women on your team, your organization, or your own leadership, this is exactly the work we do through Courageous Public Health. We partner with organizations to offer facilitated, interactive, virtual workshops for women leaders in public health, turning courage into a leadership skill so it becomes an organizational strength. Because in today's public health landscape, fear-based leadership costs organizations staff retention, community trust, and their ability to respond when it matters the most. Interested? Reach out. Links to connect with us are in the show notes. Until our next episode, stay courageous.
Thank you for listening to the Courageous Public Health Podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.